This is a presentation on common complications that can occur during pregnancy by Amanda Schrader. I am a nursing student at Indiana State University. Learning objectives. During this presentation, the viewer will become familiar with common complications during pregnancy, recognize risk factors, symptoms, and treatment of preeclampsia, recognize risk factors, symptoms, and treatment of gestational diabetes, recognize risk factors, symptoms, and treatment of pregnancy-induced hypertension, and recognize risk factors, symptoms, and treatment for preterm labor. At this time, if you would like to click out of the presentation, there is a pretest that you can take to assess your knowledge prior to viewing this presentation. Pregnancy facts. Healthy women can still experience complications during pregnancy. Just because you're healthy prior to conception does not make you immune from possible complications. 8% of all pregnancies involve some sort of complication. Beginning prenatal care early in the pregnancy can help physicians diagnose and manage complications before turning serious. Pregnancy-induced hypertension. It's also known as PIH or gestational hypertension. Occurs when the arteries are narrowed and causes increased pressure in the arteries. This makes it difficult for blood to reach the placenta and the fetus. Without good blood flow, nutrients and oxygen supply to the fetus are decreased and can cause decrease in fetal growth. The American College of Obstetricians and Gynecologists define pregnancy-induced hypertension as 2 blood pressure readings greater than 140/90. This usually occurs in the second half of pregnancy and complicates roughly 7.7% of all pregnancies. This can lead to preeclampsia, placental abruption where the placenta tears away from the uterine wall, or gestational diabetes. Treatment includes monitoring the fetus and the mother, including her blood pressure. Bed rest is sometimes used, and medications such as labetalol, nifedipine, or methyldopa can be prescribed to help control blood pressure. Preeclampsia, also formerly known as toxemia, is persistently high blood pressure that can develop during pregnancy or postpartum period. The difference between pregnancy-induced hypertension and preeclampsia is that preeclampsia has the elevated blood pressure as well as the following can be associated with protein in the urine, liver involvement, acute kidney injury, neurological complications, and hematologic complications, unlike pregnancy-induced hypertension. Preeclampsia's cause is unknown, but it can lead to preterm delivery. If left untreated, it can cause seizures in the mother, coma, or death for the mother and fetus. And preeclampsia occurs in 5 to 8% of all pregnancies. More about preeclampsia. Risk factors for preeclampsia include obesity, the maternal age greater than 35 years old, pregnant with multiple babies, or pre-existing conditions such as lupus, diabetes, or hypertension. Symptoms of preeclampsia include severe headache, swelling, or changes in vision. Treatment often includes bed rest, monitoring either at home or frequent visits to the OB office, or sometimes, if severe enough, will require hospitalization for the duration of the pregnancy. The only cure for preeclampsia is to deliver the fetus. So the mother and obstetrician would need to talk about either delivering, depending on what point of the pregnancy the mother is in. Gestational diabetes is another common complication of pregnancy. It's the development of diabetes during pregnancy. Hormonal changes caused by pregnancy can make the body decrease insulin production, which will cause an increase of glucose in the body. Without insulin, the glucose cannot enter the cells and can build up in the system. Gestational diabetes causes increased birth weight, which can cause difficulties during delivery where the baby's shoulders could get stuck in the birth canal. Usually obstetricians will do a glucose tolerance test, which is a sugary drink that the mother drinks between 24 to 28 weeks gestation, waits 1 hour, and then does a blood draw to see what the glucose levels are. Risk factors for gestational diabetes include a history of gestational diabetes with previous pregnancies and the mother being overweight. Mothers can decrease their risk of developing gestational diabetes by reaching a healthy weight prior to conception, increasing exercise, and following a healthy diet. If diagnosed, treatment for gestational diabetes usually involves diet, moderate exercise, oral medications are sometimes used, and the mother and fetus are usually watched more closely during the pregnancy. Preterm labor is labor that occurs between 20 weeks and 37 weeks gestation. This occurs in 12% of all pregnancies. This is uterine contractions that can cause the surface to efface, which is another word for thin, or dilate, which is another word for open, earlier than normal. The preterm infant has an increased risk of health issues. The lungs and brain typically finish their development in the final weeks of gestation. So delivering prior to 37 weeks gestation, the infant is not fully developed yet. Risk factors for preterm labor include cervical abnormalities, previous preterm births, a mother that's pregnant with multiples, infections, and smoking. More about preterm labor. Symptoms of preterm labor include back pain, menstrual-like cramping, increased vaginal discharge, pelvic pressure, or 5 or more contractions in 1 hour. If the mother notices that these symptoms are occurring, the mother is to empty her bladder and lie on her left side, increase her hydration as dehydration can lead to preterm labor, monitor and time her contractions, and if the contractions continue for more than 1 hour, she needs to contact her OB. Treatment for preterm labor include bed rest, increased monitoring for the infant and the mother. This can be done using a non-stress test, which is pictured here. The top line of that strip monitors the baby's heart rate, and the bottom line monitors for contractions and measures those. Medications can also be given to help stop labor. In conclusion, pregnancy-induced hypertension, preeclampsia, gestational diabetes, and preterm labor are all common complications of pregnancy. PIH occurs when the arteries are narrowed, causing restricted blood flow to the placenta and fetus. ACOG defines PIH as a blood pressure greater than 140/90. Preeclampsia is when blood pressure is persistently high and is associated with protein in the urine, liver involvement, kidney injury, neuro complications, and hematologic complications. Gestational diabetes causes increased birth weight, and treatment for this includes modifications of diet, exercise, and sometimes oral medications. Preterm labor is labor that occurs between 20 and 37 weeks gestation. And risk factors for this include cervical abnormalities, infections, smoking, previous preterm births, and pregnant with multiples. Here are the references that were used for this presentation. If you would like, you can click out of this presentation and do a quick post test to see what you learned. Thank you for watching.